in fortified breads and cereals, and in fish, lean meat, and milk also, this vitamin B1 is present. Now, vitamin B1, it has a very, very important role in carbohydrate metabolism. Now, carbohydrate metabolism topic is going on for you all. So, if you observe properly, this vitamin B1, it is having an important role in carbohydrate metabolism. This vitamin B1, it is used as a coenzyme. It is used as a coenzyme in oxidative decarboxylation. Where this pyruvate dehydrogenase, alpha ketoglutarate dehydrogenase, all these where these enzymes are acting, if you see, there even your vitamin B1 is also very important. Then in pentose phosphate pathway also, the transcletorase activity is there. There also this vitamin B1 is very important. Coming to the deficiency manifestations of thiamine. The deficiency manifestations of thiamine, as such, they are going to ask you as short questions, okay? Deficiency of thiamine is called beriberi. Beriberi means weakness, okay? Deficiency of thiamine causes beriberi, which means weakness. The general symptoms of this beriberi are anorexia, dyspepsia, heaviness, and weakness. Okay, beriberi means weakness. The generalized symptoms of this beriberi are anorexia, dyspepsia, heaviness, and weakness. Okay, if they'll ask you beriberi means, you should write about the different types of beriberi. That is wet beriberi, dry beriberi, infantile beriberi. You should mention all these. Okay. Coming to wet beriberi, in wet beriberi, majorly the cardiovascular system will be involved. Okay, the cardiovascular system will be involved, and that type of beriberi is called wet beriberi. Here, the main symptoms, apart from the general symptoms of anorexia, dyspepsia, heaviness, and weakness, the other characteristic features of this wet beriberi will be edema of the legs, face, trunk, serous cavities. All these cavities, all the face, legs, trunk, and serous cavities, they will be edematous. They will become edematous. Then the patient will be having palpitations, breathlessness, and you can see distended neck veins. You can also see distended neck veins, and death will occur because of cardiac failure. Death will be because of heart failure. After wet beriberi, the other one is dry beriberi. The other type of beriberi is dry beriberi. In dry beriberi, the CNS features will be, or the CNS will be involved. In wet beriberi, I told you the cardiovascular system will be involved. Similarly, in dry beriberi, the central nervous system will be involved. So apart from the general symptoms, the characteristic symptoms here will be that the muscles, they'll be becoming progressively wasted. They'll be becoming progressively wasted. There will be a sensory disturbance along with peripheral neuritis. There will be sensory disturbance along with peripheral neuritis, leading to complete paralysis. Then the other one is infantile beriberi. This is seen in infants, and they will be having restlessness, sleeplessness, along with episodic bouts of screaming. They'll be restless, sleepless, along with episodic bouts of screaming. Okay. Then Wernicke's-Korsakoff syndrome. This is cerebral beriberi with encephalopathy, ophthalmoplegia, nystagmus, cerebellar ataxia, and psychosis. Then in chronic alcoholics, in patients or in persons who are chronic alcoholic, in them, this alcohol, it is going to inhibit the intestinal absorption of thiamine. So it will ultimately lead to thiamine deficiency. So in thiamine deficiency, you can observe that the blood thiamine is reduced. All the enzymes, wherever all the reactions where this vitamin B1 is necessary, that reactions will stop. So those products or those reactions or those byproducts will be accumulated. For example, if you remember here, we told you pyruvate dehydrogenase and all these are required. So your pyruvate, alpha ketoglutarate, all these we are going to increase. Okay. Then thiamine nutritional status. This can be assessed by erythrocyte transketolase activation. The required dietary allowance of this thiamine is 1 to 1.5 milligrams per day. Is 1 to 1.5 milligrams per day. And this is the diagram we're showing the thiamine deficiency, showing almost all the types of thiamine deficiency. Your dry beriberi, your Wernicke syndrome, and wet beriberi. Okay, all the features are seen in this one picture. Is that clear? Now we will go to the next one, that is vitamin B2, also called riboflavin. This riboflavin or riboflavin, it has dimethyl isoalexane ring. It has a dimethyl isoalexane ring to which a ribitol is attached. Okay, it has a dimethyl isoalexane ring to which ribitol is attached. The main dietary sources of this riboflavin are lean meats, eggs, nuts, green leafy vegetables, milk, dairy product. Okay. And also because of this riboflavin is very nice yellow in color, so you can see this riboflavin, it is also used as a food additive. Riboflavin, it has dimethyl isoalexane ring. It has a dimethyl isoalexane ring to which ribitol is attached. The main dietary sources of this riboflavin are lean meat, eggs, nuts, and green leafy vegetables, the milk, dairy products also. Now this riboflavin, it is also used as a food additive. The active form of this riboflavin is FMN and FAD. Okay. It is also having coenzyme activity. This riboflavin, it exists in the tissues as it is in tightly bound form along with the enzymes. It is tightly bound to the enzyme. Now this enzyme which are going to have this riboflavin, you call them as flavoproteins. And if you all remember, this flavin coenzymes are electron carriers in oxidation reduction reactions. These flavin coenzymes, these are electron carriers in oxidation reduction reactions. Okay, so you have to remember these FMN dependent enzymes. If you remember the respiratory chain, the NADH dehydrogenase, this enzyme, it contains FMN. Then FAD dependent enzymes are your succinyl dehydrogenase, acyl CoA dehydrogenase, xanthine oxidase. So you should remember at least 2-3. So when you go through the metabolism, as we are going in further details of the metabolism, you will know what are these FAD dependent enzymes. An example for succinate to be converted into fumarate, succinate dehydrogenase enzyme, and this it is dependent on FAD. Okay, one FAD molecule is used here. Similarly, your acyl CoA dehydrogenase enzyme, xanthine oxidase enzyme, all these enzymes are FAD dependent enzymes. These are your FAD dependent enzymes. Now, the biochemical investigations are your colorimetric assay in the blood, erythrocyte glutathione reductase activity, then excretion in the blood, and also you can see for your riboflavin content of the RBC. This biochemical investigation part, it is not so important. You should know these FMN dependent enzymes and FAD dependent enzymes. Now coming to this deficiency of riboflavin. This natural deficiency of vitamin B2 or riboflavin is also very uncommon because vitamin B12, it is synthesized by the intestinal flora. So this B2 deficiency, it is usually accompaniant of other deficiency diseases. This vitamin B2 deficiency, it is usually an accompaniant of other deficiency diseases like beriberi, pellagra, kwashiorkor and all. Okay, so normally natural deficiency of vitamin B12 itself per se, it is very uncommon because this vitamin B2 or riboflavin, it is synthesized by the intestinal flora. This deficiency of vitamin B2 is allowed as an accompaniment for all of other deficiency diseases like beriberi, pellagra, kwashiorkor. Mostly the signs and symptoms, these are confined to the skin and the mucosal membranes. The signs and symptoms of the deficiency of riboflavin, these are confined to the skin and the mucous membrane. So the first important one is glossitis. The first important symptom or clinical feature of this vitamin B2 deficiency is glossitis. Here there is inflammation of the tongue. There is inflammation of the tongue which causes the tongue to become red and to become swollen. The tongue becomes swollen and there is a change in the color. There is atrophy of the lingual papillae. Atrophy of the lingual papillae and fissures of the tongue. There is atrophy of the lingual papillae and fissures of the tongue. So the first clinical feature of vitamin B12 deficiency is glossitis. It is the inflammation of the tongue. It causes the tongue to swell and also there is a change in the color. There is atrophy of the lingual papillae and fissures of the tongue. Atrophy of the lingual papillae and fissures of the tongue. After glossitis, there is also cheiliosis. Cheiliosis means is the painful inflammation along with cracking at the corners of the mouth. At the corner of the mouth, there will be the inflammation and the cracking of the corners of the mouth. That is called cheiliosis, also called angular stomatitis. Then also there is seborrheic dermatitis and circumcorneal vascularization. Proliferation of the bulbar conjunctival capillaries, that is the earliest sign of riboflavin deficiency. Okay, seborrheic dermatitis and circumcorneal vascularization also seen. And proliferation of the bulbar conjunctival capillaries, that is the earliest sign of riboflavin deficiency. This is the picture showing you the entire riboflavin deficiency. Okay, just go through the diagram once for a minute. If you see this picture, you can remember all the clinical features of vitamin B2 deficiency, like circumcorneal vascularization, dermatitis, glossitis, cheiliosis. All these are given in one picture. See, here you can see. See, it is so evident. Glossitis, it is so evident here. This is cheiliosis. If you can see, cheiliosis. At the corner of the lips, there will be inflammation and cracking. That will be very painful also. Okay? That will be painful also. That is vitamin B2 or riboflavin. The next one is vitamin B3. Vitamin B3, also called niacin. This vitamin or vitamin B3, it is also called pellagra preventing factor. Vitamin B3 or niacin, it is also called pellagra preventing factor. Vitamin B3, remember, it is also called pellagra preventing factor. Now, niacin and nicotinic acid, usually they are used synonymously. Niacin and nicotinic acid, these are used synonymously. Now, coming to the chemistry, it is a pyridine 3-carboxylic acid. It is a pyridine 3-carboxylic acid. Niacinamide is the acid amide of niacin. Okay? This is the structure. Coming to the sources of niacin: dry yeast, then rice polishing, liver, peanuts, whole cereals, legumes, meat, fish, eggs, nuts. All these are sources of niacin or vitamin B3. Dried yeast, rice polishing, then dairy, poultry, fish, lean meat, nuts, eggs, legumes. All these are sources of niacin. Now, coenzyme forms of niacin are, niacin can be converted into NAD plus and NADP plus. Okay, the dinucleotide reacts with glutamine to form its amide. The dinucleotide, it reacts with the glutamine to form its amide. Now again, like previously how you saw FAD dependent enzymes and FMN dependent enzyme, here also you should know NAD dependent enzyme. Like your lactate dehydrogenase, then beta hydroxy acyl CoA dehydrogenase, then glutamate dehydrogenase, isocitrate dehydrogenase. These are few of the NAD dependent enzymes. Okay, lactate dehydrogenase, beta hydroxy acyl CoA dehydrogenase, glutamate dehydrogenase, then isocitrate dehydrogenase. All these are NAD dependent enzymes. You should be able to write at least 2, 3. Then NADPH related enzymes, NADPH generating enzymes. Okay, the reactions are enzymes which are capable of NADPH generation are G6P dehydrogenase, that is glucose 6-phosphate dehydrogenase, 6-phosphogluconate dehydrogenase, then malic enzymes. Then the previous NADP dependent enzyme was mitochondrial isocitrate dehydrogenase, and this is cytoplasmic isocitrate dehydrogenase. See, all this will be very confusing. 2, 3 times you will read, you can remember. Okay. NADPH generating reactions are glucose 6-phosphate dehydrogenase, 6-phosphogluconate dehydrogenase, then malic enzyme, cytoplasmic isocitrate dehydrogenase. Then this is NADPH generating enzymes, and these are NADPH utilizing alpha beta unsaturated ACP into acyl ACP, HMG CoA to mevalonate, then methemoglobin to hemoglobin. All these are NADPH utilizing reactions. These also just 2, 3 you remember. Okay. And next is deficiency, niacin deficiency. I told you niacin, it is also called pellagra preventing factor. It is also called pellagra preventing factor. So this niacin deficiency, it leads to pellagra. It leads to pellagra. This disease, it is also called rose sickness. Pellagra, it is also called rose sickness. Okay. Pellagra means, it means rough skin. Pellagra means rough skin. Remember the symptoms, it is 3D, that is dermatitis, dementia and diarrhea. Dermatitis, dementia and diarrhea. Okay, niacin deficiency, it leads to a clinical condition called pellagra. It leads to a clinical condition called pellagra. Then that disease, it is also called rose sickness. It is also called rose sickness. Okay, pellagra means rough skin. And the symptoms include dermatitis, dementia, and diarrhea. Dermatitis, it is a characteristic feature of pellagra. Now there will be erythema, bright red erythema in the feet, ankles, and the face. Feet, ankles, and the face. And also unexposed region around the neck. There is increased pigmentation around the neck. It is called Cazel's necklace. This is also one of the characteristic feature of pellagra. So increased pigmentation around the neck in the sun exposed area called Cazel's necklace is seen here. Now dermatitis of pellagra, it will be precipitated when exposed to sunlight. When exposed to sunlight, this dermatitis will be precipitated. See, here you can see, this is Cazel's necklace. Okay, can you see this Cazel's necklace? This is dermatitis of the lower limbs. Then the next symptom is diarrhea. This diarrhea of the pellagra, it may be mild or severe. It may be mild or severe with blood or mucus. There will be weight loss. Okay, there will be weight loss. Nausea and vomiting also may be present. And the next one is dementia. This, it is common. Dementia is very common in acute pellagra. It is common in acute pellagra. Here there will be irritability, inability to concentrate. The person cannot concentrate on anything, and also poor memory. There will be poor memory. Posterolateral tract degeneration, ataxia and spasticity are also seen. Ataxia and spasticity. Now niacin synthesis. Niacin, it is synthesized from tryptophan by kinase pathway. Okay, in protein metabolism, you will see the synthesis of niacin. It is from tryptophan, and that pathway, it is called kinase pathway. Okay. Here in this niacin pathway, this quinolinate phosphoribosyl transferase, that is the rate limiting enzyme. Okay, niacin pathway. The niacin, it is synthesized from tryptophan by this kynurenine pathway. Here, this quinolinate phosphoribosyl transferase. Quinolinate phosphoribosyl transferase, that is the rate limiting enzyme. That is a rate limiting enzyme. So 60 milligrams of tryptophan, from 60 milligrams of tryptophan, 1 milligram of niacin can be synthesized. 1 milligram of niacin can be synthesized. Now, what are the causes for this niacin deficiency? So, niacin is deficient in which there is deficiency of tryptophan also. There is deficiency of tryptophan because niacin is synthesized from tryptophan only. So, there is deficiency of tryptophan, dietary deficiency of tryptophan, and that is seen among people whose staple diet is mainly maize. Whose staple diet is maize. Whose staple diet is maize. Okay. It is also seen in people whose staple diet is sorghum or jawar, because here sorghum, it contains leucine enzyme. It contains leucine enzyme in high quantity. Leucine it contains in high quantities, and this leucine it inhibits this quinolinate phosphoribosyl transferase enzyme. So here niacin cannot be synthesized, and that type of pellagra is called leucine pellagra. Staple diet is sorghum or jawar also, you can see the niacin deficiency, because in sorghum, leucine is present in high quantities. It is present in high quantities, and this leucine, it inhibits this quinolinate phosphoribosyl transferase, which is the rate limiting enzyme of your kynurenine pathway for niacin synthesis. So niacin cannot be synthesized, and that pellagra is called leucine pellagra. So apart from this, the other causes of niacin deficiency, apart from the dietary deficiency of tryptophan, then lack of vitamin B6, then people taking isoniazid drug in heart disease, Pap-Smear syndrome, all these people are more prone to niacin deficiency. Now this niacin, it is excreted as N-methyl nicotinic acid. N-methyl nicotinic acid. Forgot about the RDA. RDA of niacin is 20 milligrams per day. During pregnancy and lactation, it increases. During pregnancy, it is 22 milligrams per day, and during lactation, it is around 25 to 30 milligrams per day. Now, this niacinamide, this is useful in lowering the. I think that something is missing. Okay. Now, see, this is in one tabular form. The common name of the vitamin, the chemical name of that vitamin, and its related factors. Okay. You can write down like this in one place. We take vitamin B1, the chemical name is thiamine. Its cofactor or the active form of this vitamin B1, it is thiamine pyrophosphate. Vitamin B2, its chemical name is riboflavin. Here, FAD and FMN are the related cofactors, that is flavin, adenine, dinucleotide, and flavin mononucleotide. Then vitamin B6 we have not done, B12 we have B3. B3 you all also prepare like this one chart. What is it? Okay. There is no mistake in this chart. next one is pantothenic acid or vitamin B5. Okay, it is a part of coenzyme A. This vitamin pantothenic acid, it is a part of coenzyme A. It is also very essential or needed for the metabolism of your carbohydrates, fats, proteins, whatever it is. For that, your vitamin B5 is important. Okay. The food sources. The food sources of this pantothenic acid, the food sources are meat, milk, mushroom, liquid, peanut, etc. These are all the important sources of pantothenic acid. Okay, so all the animals, they require this pantothenic acid so that they can synthesize the coenzyme A, which is, as I told you, it is required for almost all carbohydrate, fats, all the metabolisms it is required. Okay. This pantothenic acid, it is nothing but it is a combination of pantoic acid and beta alanine. Pantothenic acid, it is a combination of pantoic acid and beta alanine. So in Greek, this pantos means from everywhere. Pantos in Greek means from anywhere, everywhere, and so it means it is found mostly in almost all the food. Okay, human deficiency as such, it is very rare. Okay. So this deficiency of pantothenic acid, it is very, very rare. It has been in very few cases, it has been studied, and in that also those few cases also they have seen it. They have seen it in people who are prisoners of war during World War II. The prisoners of war, then who were subjected to extreme starvation. All such people only, in such people only, they could observe these signs and symptoms of this deficiency of pantothenic acid. Okay. Otherwise, normally this deficiency of pantothenic acid, it is rare. Okay, here in them they observed that there is burning foot syndrome. There is burning foot syndrome. Okay, there is burning foot syndrome with listlessness, fatigue, sleep disturbance, nausea, abdominal distress. All these are observed. Okay, then I told you they observed this only in deficiency of pantothenic acid. It was observed in few cases where the deficiency was seen, usually in the prisoners of war. Then if you subject people to extreme levels of starvation, or in such people only they saw the deficiency of this pantothenic acid. And also alcoholics also. And also, okay, I'll just check it out. Is it clear now? It is clear now? Yeah, okay. Okay, I hope the voice is clear now. Okay, that was with respect to pantothenic acid. Now the next one is biotin. Okay. Biotin, also called vitamin B7. This is found in pre-bound form. It is found in pre and bound form. Okay. Biocytin, it is a protein bound form. Biocytin, it is the protein bound form. Biotin it is found in the small intestine, and as biotin, it is from the biotin word, it is also from a Greek word, and it is also required for the metabolism of carbohydrates, fats, and proteins. It is also required for the carbohydrates, fats, and proteins. In the metabolism, biotin is required. Okay. Now, food sources of this biotin: cauliflower, yolk, liver, peanuts, cheese. All these are food sources of your biotin. There is intestinal synthesis of biotin. There is intestinal synthesis of biotin. Now, biotin content only available in a small amount in the foods. Okay. Now, avidin, it is present in the raw eggs. Avidin is present in the raw eggs, which inhibits the absorption of this biotin. Avidin inhibits the absorption of biotin. This avidin, it is present in raw eggs. So, if you consume a dozen of raw eggs a day, every day, a dozen of raw eggs every day, then it is going to lead to biotin deficiency. Now, functions of biotin, it is going to assist in the addition of carbon dioxide to substances. The carboxylation of acetyl-CoA or malonyl-CoA during the allocation of a fatty acid chain, acetyl-CoA, it is going to form malonyl-CoA, and this carboxylation reaction of acetyl-CoA to form malonyl-CoA, this requires biotin. Then pyruvic acid also needs the addition of carbon dioxide to yield oxaloacetate for the yielding of oxidoacetate. Okay. Now these are all the functions of biotin. Now adequate intake of biotin is 30 micrograms per day in adults. In adults, the adequate intake is 30 micrograms per day. Okay. As I told you, the risk of this developing biotin deficiency, it is very rare. And in people who are alcoholics, then biotinidase deficiency people, and also those who take raw eggs, those who consume a lot of raw eggs, these people are also at the risk of developing this biotin deficiency, because avidin present in this raw eggs, it inhibits the absorption of biotin. Now the signs and symptoms. Signs and symptoms of this biotin deficiency, although it is very rare, it leads to skin rash. It leads to skin rash, mostly in the face. Skin rash mostly on the face. Then hair loss, convulsions, neurological disorders, impaired growth. Then there will be hair thinning. Nails become very brittle. Okay, nails also become very brittle. So this neonatally, they have started screening for this biotinidase deficiency. Okay, there has been neonatal screening of biotinidase enzyme deficiency so that this biotin deficiency can be known. Okay, and the next one is vitamin B6, also known as pyridoxine. Vitamin B6, also known as pyridoxine or pyridoxal or pyridoxamine. Now, the main coenzyme form of this pyridoxine is pyridoxal phosphate. It is pyridoxal phosphate, and this is also required to activate the enzymes for carbohydrates, fats and protein digestion. Carbohydrates, fats and protein digestion, mainly involved in the transamination reaction. Mainly involved in transamination reactions. Then the synthesis of hemoglobin and oxygen binding white blood cells. Then it is also required for the synthesis of neurotransmitters. It is also required for the synthesis of neurotransmitters. Okay, so it is required for transamination reactions, decarboxylation reactions, all these reactions here. B6 vitamin is required also for the synthesis of neurotransmitters. Your meat, fish, poultry, whole grains, banana, spinach, avocado, all these are the sources of vitamin B6. Meat, fish, poultry, whole grains, banana, spinach, avocado, potato, all these are good sources of vitamin B6. This vitamin B6, it is passively absorbed. Now, I told you there are 3 forms of vitamin B6, which all the 3 forms of B6 are phosphorylated in the liver, and it binds to the albumin for it to be transported in the blood. Then B6, it is stored in the liver and muscle tissue. It is excess, whatever is excess, it gets excreted in the urine. Now I told you all this already. It is required for your carbohydrate metabolism, lipid metabolism. It is involved in your RBC synthesis. Okay, it is involved in RBC synthesis. Then the structural rearrangement of amino acids, that is racemase reaction. The structural rearrangement of amino acids. Then transamination reactions, decarboxylation reactions. So in all these reactions, your vitamin B6 is required. And neurotransmitter synthesis, conversion of tryptophan to niacin. Here also B6 is required. RD of vitamin B6, it is 1.3 milligrams for adults. Average intake, whatever we are taking it, it is usually more than your required dietary allowance. Now, vitamin B6 deficiency is mostly seen in elderly. It is usually seen in elderly and those who are alcoholics. Those who are alcoholics. Okay. B6 deficiency, it is usually seen in elderly and alcoholics, because alcohol, it is going to decrease the absorption of this B6 and also it is going to destroy the coenzyme form. It is also going to destroy the coenzyme form. And this B6 deficiency, it usually causes dermatitis, seborrheic dermatitis, then atrophic glossitis, along with ulceration, angular cheilitis, then conjunctivitis, all this will be present. Okay, seborrheic dermatitis with atrophic glossitis, ulceration, all this will be present. Then there will be microcytic hypochromic anemia. There will also be convulsions, depression, confusion. Then it will lead to a reduced immune response. There will also be peripheral nerve damage. Okay, these are all the deficiency of vitamin. Okay. So this is all about vitamin B6. So sorry. So we will left folic acid and vitamin B2. We'll see in the next class. Okay. Roll there. Roll number 25, are you there? 25, are you there? Roll number 25. Roll number 21. So 25 and 21 are absent. Roll number 49.
21 present, ma'am.
Oh, what happened? You did not respond immediately. 21, na? Roll number 18, are you there?
Hello.
I think you're 21. Okay. 21 is there. So 21, what is Fanconi syndrome? Twenty-one went off. Twenty-one. Problem number 18. Okay, I think your voice is not coming to me, or what? I don't know what is the problem. In the next class, water soluble vitamins. Water soluble vitamins. I'll give you some questions in the next class to write. Okay, so be prepared for it. I'll continue in the next class. Everything is clear, right? After going back home, you read all the FAD dependent reactions, NAD dependent enzymes, all those you read for 2-3 times. You'll become familiar with them. Okay. In the next class, we'll continue with folic acid and vitamin B12, and we'll wind up these vitamins. Okay. Thank you.
Thank you.